Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, global markets reporter at Nasdaq. Joining us for this segment, we have Joe Spector, co-founder of Dutch, a virtual health platform for animals launched in 2021. Joe, it's great to have you with us. Welcome to Trade Talks.
Thank you for having me.
You got it. And what trends are you seeing in the industry and the critical challenges that face veterinarians?
It's the perfect storm. We're seeing a massive veterinary shortage, and then we're also seeing massive adoption of new pets that started even before the pandemic, accelerated, and still continues to show up.
What solutions does Dutch provide, and how many pets do you serve?
So Dutch is really one of the first, maybe the only platform that actually connects you to veterinarians who are able to treat and provide medical solutions to pets. We've served 25,000 members since we launched a few months ago. And there's over almost 100 veterinarians on our platform speaking with pet parents every day.
What was the genesis to start Dutch?
It really came out of a personal experience. I started HIMSS prior to this, and having built up telemedicine for men and women, I saw that on the veterinary side, you really needed innovation. And that was an area that really hadn't had as much telemedicine development as we've had on the human side.
So, Joe, just to understand the platform better, how do you connect veterinarians and the patients, their owners?
Totally. So you sign up for Dutch.com, our service, and essentially within minutes, you're able to have a video chat with a veterinarian on our platform who can take down your pet's medical history and provide a treatment plan to your pet.
So it sounds really similar to what we do as humans when it comes to telehealth. It sounds like it's modeled pretty much so like that.
Very similar. Yep, it's very similar in the human health way.
And Joe, you just raised 20 million in a Series A round, bringing your total funding to 25 million. What will that allow the company to do?
So we're continuing to invest in our own proprietary medical record database, which will continue to amass your pet's medical history and put the power of your history in the hands of the consumer. We're also investing in marketing and investing in operations. So our pharmacy network, and then other innovations like mobile solutions to really bring veterinary care to the customer.
Yeah, as the mom of 3 rescue cats, it's certainly interesting. It's always hard to be, even when you have kids, to time if something you need the doctor right away or the vet right away, and you're in the office. There's only so much that you can do when you're separated by the subway and the train to get back to the other side in New Jersey. So overall, what's the outlook for future growth?
There is going to be continuous need for pet health, and telemedicine can really help alleviate the pain in the brick and mortar system that we're seeing today. There's also an opportunity for many more pet parents to actually get access to healthcare. What we see is oftentimes you really take care of your pet baby in the beginning of their life, at the end of their life, and then there's this gap in the middle. And I think we can take out a lot of the friction and bring a lot of those pet parents back into the system and actually bring healthcare to their pets.
So just like doing preventative care as we do with humans, Joe, one more question for you. We do know that the cost of healthcare really is what delays people from taking care of their health in a more proactive way. We know procedures for animals can be more expensive as well. Is there anything that's more cost effective via Dutch because of its efficiency and the strength of its network?
Dutch is super cost efficient. So our vet visits are $15 for the month, which gives you unlimited vet interactions. And then the cost of medicine, we put that in the power of the consumer. So the consumer, as opposed to getting a basket of products that you don't know what's in your goodie bag when you check out, you have full control of what medicine, of what products you actually end up choosing. So the affordability component is really in the power of the consumer.
Right, that's a great idea, especially for elderly animals and for those of us that do rescue. You don't always know the history behind, the different animals that you are rescuing. Joe, it was great to meet with you. Thanks for joining us on Trade Talks. I'm Jill Malandrino, global markets reporter at Nasdaq.